Healthy People 2020 HIV by Kelly Felmuth.
Aniolo Tula.
Laura Franco.
Ling Wen.
Chad Adams.
The 2020 objectives we chose for this presentation are to reduce the number of new HIV diagnoses and to reduce deaths from HIV infection. In 2010, the baseline new diagnosis was 43,806 people, and the target goal is to reduce this number to 32,855. The baseline for the deaths from HIV is 3.7 3.7 deaths per 10,000 individuals, and occurred in 2007. The target goal is to reduce this to 3.3 deaths per 100,000 individuals.
The class objectives are: the viewer will be able to teach back the vital techniques that are necessary for HIV prevention. The viewer will be able to utilize the information and examples provided in this presentation in order to reduce the HIV infection rate. The viewer will incorporate the importance of treatment compliance in order to reduce the mortality rate of those positive with HIV.
HIV, or human immunodeficiency virus, is a disease transmitted through bodily fluids. That includes blood, semen, vaginal secretions, and breast milk. Once the virus has entered the healthy individual, it begins attacking the body's immune system. Damage to the immune system means an increased risk for an infection and also contracting other diseases or even certain cancers. Eventually, HIV will progress to AIDS. There is no current cure for HIV, but with the correct medical management, the virus can be controlled. Risk factors of obtaining HIV include unprotected sex, multiple sex partners, occupational exposure, perinatal exposure, blood transfusions, and IV drug use with contaminated needles.
HIV testing. The NAT test looks for the actual virus in the blood. The test can give either a positive or negative result or the amount of virus present in the blood. It is a costly test. Antigen or antibody test looks for HIV antibodies, antigens. Antibodies are produced by your immune system when the HIV virus attacks your body. The rapid antibody screening test, the results are ready within 30 minutes or less. These tests are used in a clinical or non-clinical setting, so you can use it at home by simply pricking your finger or taking an oral swab of your mouth. The oral fluid antibody test, which you can do right at home. You can swab your mouth, and the results are ready within 20 minutes. The home collection kit involves pricking your finger and mailing a sample to a laboratory and getting the results the next business day.
One of our 2020 People Healthy objectives is to reduce the number of new HIV diagnoses. In the past, HIV testing has been completed on those individuals who are considered to be at a higher risk of contracting the virus. So those individuals with multiple sexual partners or who partake in IV drug use. But it has been proven that this is an ineffective strategy for early detection and prevention of HIV. And now the U.S. Preventative Services Task Force and the Center for Disease Control recommend that routine HIV testing should be implemented for all adults up to age 65. Many nurses hold positions in which they're able to promote their patients to get HIV testing regularly and offering it to all their patients. And a study from MedSurg Nursing explored this theory, and they implemented that all nurses on a MedSurg floor will provide their admitted patients with the option to be tested for HIV. There are benefits to the implementation of routine HIV testing to the general population and not just at-risk individuals. And these benefits all relate to helping to reduce the number of new HIV-related diagnoses. So the CDC has stated that around 20 to 25% of the 1.2 million people living with HIV are actually unaware that they have the virus. If people are provided with more education and more opportunities to become aware of their HIV status, it can help with preventing the infected individual from unknowingly transmitting it to others. Studies have also shown that early detection of HIV is correlated with a significant improved prognosis. And this can relate to our 2020 objective of reducing the amount of HIV related deaths. Once HIV is detected, treatment can begin. Early treatment can improve quality and quantity of life and help prolong the progression to AIDS. The study from MedSurg Nursing did find that there are some barriers to implementing routine testing and having certain patients get early testing. Some nurse-related barriers includes that nurses fear a negative reaction from their patients after offering HIV testing. Also, nurses feel that, well, some nurses felt that they didn't have enough knowledge to be able to discuss this topic with their patients and educate them on what they need to know. And 76% of nurses who participated in this study stated that they never or rarely educated patients on the factors of HIV. 76% is a pretty high number, so more than half of nurses have never discussed HIV with their patients. Some patient-related barriers included patients that believe that they're not at risk for contracting HIV, so there's no reason for them to be tested. And other patients are worried or scared about the potential of a positive test, so they rather just not find out at all. Breaking down the barriers that were stated in the previous slide can help with the implementation of routine HIV testing for all individuals. So nurses can be proactive in their areas of work. They can educate and improve towards policy change in acute settings to be able to implement more routine HIV testing. Nurses can also increase their knowledge on HIV so we can stop with the barrier of nurses feeling that they do not have enough knowledge to discuss the topic of HIV with their patients. Also, nurses who are confident in their knowledge can help form a healthy nurse-patient relationship. In return, patients probably will feel more comfortable discussing HIV and actually allow for testing.
HIV prevention. Another way to reduce the instances of HIV or reduce the risk is not engage in any sexual activity, which includes oral sex or anal sex. Another alternative method is proper condom use, which includes female and male condoms, or using a drug called PrEP. Proper use of male condoms and female condoms. Latex condoms provide the best protection. If you're allergic to latex condoms, you can try plastic or synthetic condoms. Using water or silicone-based lubricants can reduce the chances of a condom breaking or slipping during intercourse. Read the label for expiration dates and do not store a condom in your wallet. Female condoms are a thin patch made of synthetic latex. When worn in the vagina, they can help prevent HIV, STDs, and pregnancy. They cannot be used at the same time as a male condom because of friction it can make the condom tear. Lubricating the condom can prevent slipping and tearing. Remember to read the expiration date. PrEP stands for pre-exposed prophylaxis. This is medication that you must take daily to prevent HIV. It prevents HIV by more than 90%. The PrEP drug is called Truvada. Truvada protects your body by stopping the virus from entering your cells.
So HIV staging is based on your CD4 counts. Stage 1 is when you first exposed to HIV, and an acute infection occur from 2 to 3 weeks. And there's a larger amount of viral level in your blood, and CD4 count is greater than 500 cells per cubic millimeter. CD4 count is greater than 500 cells per cubic millimeter. And at this stage, HIV test may negative because the lack of the antibody development. Usually your body takes up from 3 to 12 weeks to develop an antibody to fight with infection. So sign and symptom could be asymptomatic, flu-like symptoms such as fatigue, night sweat, muscle ache, swollen lymph nodes, rash, and sore throat. So because of the HIV test negative and a large viral level with minor symptoms, we are worried about the risk of silent transmission at this stage. Stage 2 is a prolonged period of increased viral load gradually, and your CD4 remains from 200 to 499 cells per cubic millimeter, and you may feel well or have a few symptoms. So in this stage, if you are adherent to the treatments, you can prolong this period 2 years. Stage 3 is when your CD4 is less than 200 cells per cubic millimeter, and at this stage, an diagnosis come up. Severe immune suppressions put you at risk for life-threatening opportunistic diseases. So without treatment, death can occur. Signs and symptoms could be respiratory distress, weight loss, nausea, vomiting, loss of appetite. Neurologic manifestation could be memory loss, decreased attention span. So basically, when your CD4 low, it will increase the viral load and increase the risk of complications such as risk for infection, risk for opportunistic diseases.
In order to decrease the death rates of HIV, it is important to know the causes, trends, and prevalence of mortality in those infected with HIV. Mortality has been found to occur to those that are HIV positive between the ages of 20 and 65 years old. Death rates are higher for males rather than females. HIV mortality is more likely to occur in residents who live in a rural area as opposed to urban areas. Systemic infection complications contribute to organ failure and death to patients that are HIV positive. Neurologic mortality in HIV. HIV affects the central nervous system, which causes cognitive impairment and can lead to dementia. The older individual positive with HIV is at risk for death related to complications associated with dementia and Alzheimer's. Death in HIV has also been associated with other neurological impairments, including bacterial meningitis and HIV encephalopathy. Cardiovascular mortality in HIV. HIV positive patients face mortality related to cardiovascular dysfunction. HIV patients are considered to be high cardiovascular risk due to the infection's immune activation and inflammation process. It has been found that HIV positive patients are more likely to be left pharmacologically untreated for cardiovascular conditions. Other reasons of death with patients infected with HIV include cancer, pulmonary diseases, kidney failure, and liver failure.
So these are the list of the opportunistic infections that associate with your HIV infections. It could be caused by fungus or virus or bacteria. As you know, without treatment, you can control the virus to increase the amount in your body, so it would put you at risk for infections, and especially like pneumonia and tuberculosis. There remains a major cause of death in people living with stage 3 HIV. So the best way to prevent an opportunistic infection is by adhering to treatment and getting routine checkups. It's also important to use condoms during sex, get vaccinated, and eat properly prepared foods. So these are the list of the cancers associated with HIV, and I have included some pictures of it. It includes Kaposi sarcoma, non-Hodgkin lymphoma, Hodgkin lymphoma, skin, lungs, anal, cervical cancer, hepatocellular carcinoma, head and neck cancer.
Death prevention requires treatment cascade. Treatment compliance is a very important factor in reducing the number of deaths from HIV infection, but there are also other factors that can interfere with following the necessary treatment. In 2011, a treatment cascade was established. HIV treatment cascade, or HIV care continuum, is a model of care in which the goal is for people living with HIV to achieve viral suppression. This concept is used not only to establish the steps that are needed to be set in place to achieve the goal of viral suppression,
but it also makes it easy to pinpoint where the gaps in the continuum of care may exist. This tool can also be used to educate the patient on how every step in their care is important when they're diagnosed with HIV. HIV medication treatment. Patients who have been diagnosed with HIV are placed on a treatment regimen, which consists of a combination of drugs called ART, antiretroviral therapy, to treat HIV infections. ART regimen should be started as soon as possible after the diagnosis of HIV. The main goal of these medications is to reduce the individual's viral load to an acceptable level. Patients with HIV who maintain an undetectable viral load have no risk of transmitting the disorder to non-HIV partners during sex. ART does not cure HIV, but instead it helps the patient live longer and healthier lives. What medications are included in an HIV regimen? The medications available are numerous and they are grouped into 7 different classes based on how they work on the virus. The usual initial HIV regimen includes 3 medications from 2 different classes. Choosing the right medication regimen is dependent on different factors, including the potential drug interactions. Having a wide variety of medication regimens to choose from is important in order to allow the patients with different medical needs to have a possibility to manage their HIV status. How does the medication work? The ART therapy regimen prevents HIV from multiplying, therefore reducing the amount of HIV in the bloodstream, which is called the viral load. Having less HIV in the body allows the immune system a chance to recover. The patient has still some HIV in the bloodstream, but the immune system is strong enough to fight off the infection caused by the virus. Therefore, by reducing the amount of HIV in the patients, we are reducing the risk of HIV transmission. HIV medication education. The side effects of ART treatment vary from person to person, but overall, the benefits outweigh the possibility of facing any side effects. Furthermore, new medication regimens cause fewer side effects than medications prescribed in the past. Drug interactions. HIV medication can interact with other HIV regimens, as well as other medicines, supplements, vitamins, and herbal products. Therefore, it's very important to educate the patient on the importance of consulting their physician when adding a new medication to their daily routine. Drug resistance. This can be caused by a mutation in the HIV virus. If the patient is taking medications, it can also cause drug-resistant strains of HIV to develop. This can be also caused by poor adherence to the medication.
In summary, what have we learned to reduce the risk of HIV infections and reduce death in HIV patients? It's very important for hand washing, use condoms and gloves, medication compliance, prophylactic therapy, such as antibiotic, antiviral. Do not eat raw foods, like fruits or vegetable, or undercooked food, like meat or fish or eggs. The internal temperature should be at least 165 Fahrenheit. Avoid cleaning your pet boxes. Clean your countertops after repairing raw meat or poultry. Bath daily using antimicrobial soap. Skincare to maintain your skin integrity. Oral care also important. Wash dishes in hot water using a dishwasher machine if available. Avoid to expose to people who are sick, the crowds, or traveling to countries with poor sanitation. Wear face masks when you're in public. If you find any abnormal findings, you should contact your healthcare provider immediately. Maintain your routine lab tests to check your viral load, CD4 counts. Also do malignant screening routinely. You should maintain your fluid from 2 to 3 liters per day and your nutrition intake. High calorie, high protein is recommended. Avoid live vaccines in HIV patients.